This month is Testicular Cancer Awareness Month. This type of cancer is most often developing in young men and middle-aged men, and early detection and treatment is key. To help us learn more, we turn to U of L Health and Dr. Jamie Messer. Thank you so much for taking time with us today, Dr. Messer.
Oh, thank you so much for having me.
Let's go ahead and start with the symptoms. What should people be looking for, and when is it time to go ahead and get in with your doctor?
The main thing, the initial presentation typically is a painless mass within one of the testicles. And, we normally recommend for young men between the ages of, 15 to 40 to, perform a monthly self-exam. If you notice a lump that's not consistent with what you've normally felt, I think that's the best time to kind of seek the advice of your healthcare provider.
And how is this form of cancer diagnosed if someone does perform that self-check and finds something out of the ordinary?
So what we typically perform is we get an ultrasound of the testicles to see if there is an actual mass within the testicles. Once that's done, we typically perform blood tests, which allow us to check for certain tumor markers that are present for patients with certain types of testicular cancer. And then typically, if a tumor is identified, we do recommend surgery to remove the testicle, which gives the diagnosis and then also the type of testicular cancer, which helps to guide treatment in the future for the patient.
What does treatment look like? Is recovery possible?
So the good thing, and I think the reason that testicular cancer should be in the public health awareness, is treatment is actually very successful for testicular cancer. Out of about 10,000 cases annually in the United States, there's only about 400 deaths. And the cure rates can be quite high, especially for early stage disease in patients with testicular cancer. The treatment can involve a combination of additional surgery, chemotherapeutic regimens, and sometimes radiation therapy, but the cure rates can approach 96 to 98% for patients with low stage testicular cancer, which I think is the importance for patients to really try to get into their healthcare providers early and get started on treatment as early as possible.
Absolutely. That's why something like this is so important, that awareness just so crucial. Thank you so much for taking time with us today, Dr. Messer.